Okay, how come she gets to sit? You got me twisted up like a pretzel
Because you
already.
have pants on.
Well,
So-
I'm be happy to take them off if it means I can get out of doing this.
Well, then I'm out to move.
Dr. Theresa Larson is here today. We're talking about lower back pain. Wouldn't you say most people experience some kind of back pain throughout their life?
Actually, 10% of Americans have low back pain right now.
Right now, as
Right
they're
now.
watching, yeah. Okay,
Yes.
what am I stretching here?
So you're stretching your big filet mignon of a hip flexor. So this filet mignon, if you were to eat somebody, this is what you'd want to eat.
That's-
but don't do that, okay? This is actually, this hip flexor attaches to your low back. And when you sit for hours on end, right, we have a sedentary life,
Right.
that hip gets really, really
Okay,
tight.
now during the break, I stretched the other side and it already started to cramp. Is that normal?
No, we don't want it to cramp.
Okay.
so let's-
Or fall down.
And,
Okay,
and
there we go.
stability actually matters too. for the-
Stability?
Stability. You know,
Mental
stand-
stability or physical stability?
Mental stability first, and then standing on one foot.
Okay,
is
I
important.
actually do these at home because
you do?
I do have hip flexor problems.
Okay.
If I run or jog or something, that's the first thing that starts to tighten up. And then there's one other I do where I put my leg up on the bar in front of me and kind of turn my knee to one side. Here, I can show you on the back.
Okay.
So you tell me if
Please
this is
do.
a good or a bad stretch back here.
Okay.
I'll do one of these.
Oh yeah,
Just
so
try
a
to get that
pigeon
hip flexor.
stretch.
Yeah, like so.
So you are
push that
stretching
down.
your rotators in your hip, which
Okay.
there's like 6 of them that get real meaty and tight. So this is a great stretch for those rotators.
Okay, but that's different than the one you
That
just
is
showed us.
different than
Okay.
the one I just showed
And
you,
of
but
course,
it isn't-
Now, if you could help me get my leg down, that'd be great.
Let me help you.
Okay.
And you know what Linda was doing was a little hamstring stretch. You guys
Yeah,
can do
torture
this
her
at
for a
work.
minute.
I will. So Linda.
You really feel that in your hamstrings. I mean, probably not so great in a skirt, but.
So yes, but we didn't want her to put her leg up on the chair. But at least
I
if
dared her.
if you're wearing a skirt, you can do this quite easily at your desk. But guys,
Right.
like every 30 minutes, you should be doing one of these drills that you just saw: hamstring, hip
Now,
flexor.
doctor, when we do
Every
this, though,
commercial.
we both just
Right.
we've done hips, we've done a little bit of the legs. We haven't touched our backs.
Right. So, but the thing is, the problems in the low back needs stability. Oftentimes, the hips and the thoracic spine, your rib cage, get really stiff just from being sedentary, right? So your low back takes the blunt.
Okay.
So the point is to stretch your hips, mobilize your hips and your mid back to help your low back.
Isn't that true with a whole lot of the body's physiology, in that things are all connected? And
Yes.
You have a problem in one place, but it didn't start there.
Right.
Okay.
It's usually, so where the pain is, it's called regional interdependency, isn't usually the cause.
It's somewhere
So
else.
It's somewhere else. So shoulder injury, right? It comes from either the neck or maybe the mid back. If you're an Olympic weightlifter, it could come from your ankle. The low back usually, because of people are sedentary, come from the hips and the thoracic spine from being...
Well, show Linda another exercise.
Yeah, so how else can we do this
Show Linda.
where we don't have to end up somewhere, that we can take care of our lower back ourselves?
So go ahead and stand up, you guys. The biggest thing that you can do, it's not just stretching, it's how you carry yourself, your posture, right? So go ahead and just,
How's this?
so stick out your butt,
Poser.
stick out your butt like this. So this is
Okay.
like sexy pose, not
Stick
so
out your butt.
sexy, not sexy for your low back. Yeah,
Right.
stick out your butt. This is how people walk around, right? Kind of nice.
you want me to walk around like
No,
this now?
I do not. Now, I don't want you to walk around like that because
nice
it's
look.
actually not that sexy, even though.
Oh, I
you
didn't
know,
think
people-
so either.
But then the other thing is, a lot of people kind of stand like this,
With their
right?
shoulders
Right.
slumped?
This is also not sexy, right? But if you stand up straight, squeeze your butt, be proud, loud and proud.
Oh, you're not with your hands. You mean clench.
No, yeah, you don't have to touch your butt,
Okay, good.
but you can, but at a different
Like in the
time.
military. You know, it's
Squeeze your
almost
butt.
as if, you know, the way they stand so
But you want to
straight.
relax.
Oh,
so
okay.
think about like a line. Like I'm pretty tall. I think I'm taller than both of you, right?
I'm right at 6 feet or just
Okay.
a little under now.
Definitely
I'm shrinking,
taller than
you know.
me.
Yeah.
Yeah.
But you think of a plumb line pulling your head towards the sky,
Okay.
elongating you. And squeeze your tush, maybe about 10% max tension. Not exactly, you know,
You know what just happened right there? She looked at my eyes and she saw the concentration as I'm thinking 10% squeeze,
Yeah.
and I was calculating and squeezing.
You know,
and
if you were
she
to
saw it in
squeeze
my
100%,
face.
you know what that would be for, like a big lift or maybe something
Right.
in the bathroom. But now it's just 10%. 10%, that's it.
Okay.
And as you can see when you squeeze your butt, everyone do that right now, your low back kind of becomes more neutral.
Yeah.
Right. Okay.
And that's what you want. And then relax your
So
shoulders.
it's all about that core, kind of, isn't it?
The core of the core. Now, the other thing is, if you think But you got your diaphragm, right? Your rib cage. You don't want to have your chest up. That's not an awesome cue. Ladies, also not an awesome cue. Draw those ribs down. So not hunching over, but like those ribs should be flush with your abs.
Okay.
Okay? So
People do hold tension in a lot of places all over their body, don't they? And
Yes.
that really can't be good.
No, but the thing is, you can fix it just by your posture, right? Don't sit like this. Don't walk around like this. Okay?
Why are you looking at me when you say that?
You're just at eye level.
Okay, good. You got off easy on this one.
You're always walking around like this.
But the movement piece is the most important. The postures you hold during the day are the most important. Get up and move every 30 minutes. Those hip stretches are excellent, but they're not going to be the complete fix for your low back.
I think when people try those hip stretches, they're going to be shocked at how tight they are through that area. They
Oh
had no
my gosh.
awareness whatsoever.
Yes, and you guys, this isn't just a 30-second one and done. This is a 2-minute long stretch. Research shows that you need 1 minute and 30, right, time doing a stretch to make a change over time. This isn't a quick 15 seconds, good, I'm good to go. No, you're not.
Where can we get more info?
So my website is movement-rx.com.
Movement-rx.com.
Tons of free videos, you guys, on how to care for your body, right? Fix before it's broken. Let's
right.
do
Fix
this.
it before it's broken.
Thank you so much.
You're
Did you get a
welcome.
card?
Yeah, I will.
Oh my gosh.
Good. I have to go practice walking like
Yes.
this now.
So don't stick out your butt, okay? Don't do this.
All right, when we come back,
10%.
Whole Foods, it's got a little recall that you need to know about, especially if you like their blue cheese.
Yeah, look at the packaging.
Yep.